Welcome, everybody, to Episcopal Community Services Forum on Justice and Opportunity. My name is Iola Harper, and I work for a nonprofit called the Enterprise Center. And there we are concerned about economic justice for business owners. But today, we're going to talk about the benefits cliff. We are here today at Episcopal Community Services St. Barnabas Community Resource Center, which celebrated its opening this past June. And here at St. Barnabas, they offer a food pantry, workshops and coaching in health, wellness, finances, and housing. They have community meeting spaces such as this beautiful room that we're in. They have computer labs. They partner with organizations such as Episcopal Legal Aid and Malvern Behavioral Health and much more. So we're glad to be here today. And like I said earlier, our topic is the benefits cliff. And it's one of ECS's leading advocacy issues. ECS has been raising awareness on advocating on this issue since 2019 in collaboration with our partners. Here are some examples of advocacy work that we've done. Following our 2019 forum, we sent a petition to Pennsylvania U.S. Senator Casey and Toomey, asking them to pass the Able Age Adjustment Act, which would allow even more individuals with disabilities to save without losing their eligibility for public benefits. We've also been working with PA State Senator Art Haywood, who was one of our 2021 forum panelists, and his staff on the benefits cliff issue in Pennsylvania. So now I'd like to introduce the panel here. First, I'd like to introduce on the very end, Karen Shokoff, and I want to welcome you back to the forum. Karen is a founder and CEO of LEAP Fund. Karen has been a valuable partner with us in this work since 2019, where she made her first appearance with us for the 2019 forum. Karen is dedicating her career to creating products that empower optimism, financial and career growth, future planning, and provide security for working families that are in need of it. We also want to welcome Mitch Little. I know Mitch Little from the time that I worked at the city, and he's the executive director of the City of Philadelphia Office of Community Empowerment and Opportunity. Mitch joined CEO in 2013, the year the organization created the Shared Prosperity Philadelphia, our plan to fight poverty. The office acts as a convener, funder, and evaluator to advance initiatives in benefit access, housing security, learning preparedness, financial security, and workforce development. Next, I'd like to welcome Jennifer Wolf, Program and Policy Associate for FAN. In a classic Great Minds Think Alike scenario, Jennifer reached out to ECS last year to inquire about possible advocacy partnership opportunities, just at the same time that ECS had been considering reaching out to FAN. ECS recognizes the importance of health policy issues and a holistic approach to economic mobility. It should be noted that there is even a greater health and well-being pillar in ECS's Bridge to Prosperity coaching model. And finally, I want to introduce you to Niebert Richards, ECS's Senior Director of Housing. Niebert joined ECS in 1996 as a foster care social worker and has held a variety of positions of increasingly greater responsibility across programs during her tenure. She is a licensed social worker in Pennsylvania. So now, got that out of the way. Let's get the conversation started. We are here to talk about something critically important, and that is the benefits cliff. And the best way to describe the benefits cliff is to read a definition that Karen created. She has a website called benefitscliff.com where this was pulled from. And it says that people face a benefits cliff when they receive public benefits from the government, earn a raise, and then discover that they make too much money to receive benefits, but yet they're not making enough money to sustain themselves and their household. This is a horrible quandary to find yourself in. The public policy dynamic can affect an entire array of public benefits, not just one. And it can also affect the ability of individuals and families to accumulate wealth by restricting the amount of savings or assets that they can accumulate while on public benefits. Recently, we've also experienced a new twist, and that is that we had an abrupt ending of COVID relief measures that supported individuals and families throughout the pandemic, and it made a great impact on reducing poverty. So I want to just say, you all know something about this, and you all have examples in your daily work. So Mitch, why don't you start by giving us some examples of how ACA specific, Mitch, why don't you just talk about the benefits cliff? I'm trying to stick to the script, but it's not working. Why don't you give us some examples and share some insight with us about this?
Sure. Thanks, Iola. Good seeing you.
Yes.
Thank you, ECS, for the invitation. Really happy to be here. For all the folks who come out in the inclement weather and those folks who are joining online, thanks to the panelists. It's kind of intimidating when you're talking about something that somebody has a whole website about. I don't know why I'm starting, but I'll start. And so, a part of the issue of the benefit cliffs is really rooted in, even before we start to get to like solutions and the current problem, I think we have to always have a historical context in which we're operating in. And so the system is broken, folks. There are calculations and measures and rules and regulations that are simply outdated. And they're rooted in really this sense of charity and deservedness. And race and place often have a context when you're thinking about who is deserving and how does one consider charity, right? And oftentimes, if you have that lens, then really the effort is really about maintaining the status quo, quite often, to keep us off the brink of calamity and anarchy, right? To keep things in place, because there's an acceptance that there will be the haves and the have-nots, and that's a part of society and capitalism, and those things should be expected and also accepted. And so if that is the framework then we're operating in, then there will never be enough sort of resource to really attack the problem, because the effort is not solution-oriented, it is simply to maintain. All right, race, economy, equality. So I just wanted to start the conversation there, right, to level set. And so in that sort of broken system, there are a mismatch of what qualifies individuals for benefits. And so 138% of the poverty line, 150% of the poverty line. Our office uses community service block grant dollars. It's 150% of poverty for almost 48 years of the time that community services block grant has been in existence, and then 200% as a result of COVID, as an example. And so the system can change in response to something that the system sees as pearl, right? Important enough. And so that change was temporary, but we've sort of fought to make sure that through advocacy, like this effort today, fought to make sure that change stuck. And so the system during COVID has shown ability to change. And so I think that's why today's event is so important and this conversation is so important. And so I think we have to look at sort of the sort of differences in how folks are eligible and do some of that work as government employees, as policymakers, as electeds, to really take the onus and the responsibility off the individual, simply the same as the deservedness piece, right? It's the individual's responsibility to pull themselves up by the bootstrap. It is not. It's the system that creates these conditions, nor is it the individual's responsibility to fix. How we figure out how do you get most of the benefits as you can that you're eligible for to meet the needs of yourself and your family. And I think it really, really starts there. The second place I think is important is this idea of oftentimes, people say folks don't want to work, or these are just simple excuses about how do you get out to be a full participant in society. When in fact, the folks that we're talking about, as a matter of dignity, want to work hard, want to prove themselves, want to show the value of their work, end up in something tangible, a home, a car, college education, something for their children, right? And so I think that we have to really think about, as we think about recertification, as we think about rules and limits, how can we as participants of the systems and institutions really make those changes so it takes that burden off of those individuals. And so when we started Benephilly some years ago in 2014, it was with that premise. How can a person go in and get as many benefits as they can at one time, and then some of that work about recertification happens automatically, or we're notifying folks or connecting folks to resources in real times to take that burden away. What if we could expand that, both with our community partners, our nonprofit partners, but also inside of government, city, state, and federal? And I think that's where the rubber meets the road.
Thank you. Karen, why don't you share some insight that you have?
Well, I'm going to take us left of center, so I actually want to hand it to Niebert first. I just want to +1 Mitch on all this stuff, but I'm going to hand it to Niebert.
Oh, we going to go deep? Okay, let's go.
Good afternoon, and I'm certainly glad to be here as well amongst my ECS family and my fellow panelists here, and all of you. So when I think about some of the examples of what we've experienced, what we've seen, I'm coming from the lens, or I have the lens of our rapid rehousing program that is one of our main housing program here at Episcopal Community Services. And our participants who are enrolled in that program are already very much below the poverty level and experiencing, also have had an experience of homelessness. They're also already getting a subsidy for being part of our program, which assists them in their housing. So the pandemic hit. Everybody in the world was affected. The usual things of now your children were home and you had to figure out how to still work was the same thing. The same thing for the person making $60,000 a year was the same experience for the person making $10 an hour or $15 an hour. And ergo our families. So one of the things that the COVID relief funds offered, and I can speak from that perspective, is the economic payments that our families received. So they received that. It was, to some extent, it was helpful, or for many extents it was helpful. It was helpful to a lot of people. So it allowed some of our families at that time to come current on their tenant portion of rent, to keep up with their tenant portion of their rents. Maybe making sure they were able to stay on their CAP programs, their programs with the electrical company and so forth, so that they were able to still make sure they made those minimum payments, things like that. And also maybe just to be able to cover food, because we all know during that time, for all of us, and still now, the cost of a bag of chips, the bag of chips is smaller and the cost has gone up. So just as it affected all of us, it affected our families as well. So those things were definitely present, and those were the things that were like, I can see right away, and my team could see right away. So our families were able to do some of that. There are a small few of our families saved some of that money. They were working with us and our coaches to put maybe $20 aside, every other month out of this money. And some of them felt really empowered that they were able to pay the full cost of their renter's insurance, and they didn't have to say, ECS, are you able to help us out? So some of them were able to do that. So when those payments stopped, I think that's one of the things I saw immediately as like that swift, abrupt end to those services. The other piece is that they were already getting a subsidy. So our families kind of fell into that space of, you're already getting a subsidy for a discount on your rent. So those rental assistance programs for renters, they didn't fall into that category that they can get that because of hardships from their jobs, laying off, or not having enough people to come in, so they've closed things down, which we had a few people who lost their jobs because of that. The jobs weren't open. They didn't have enough people to be there, or because of illness or what have you. So they weren't collecting a paycheck. And they couldn't go to some of these programs to say, I need some help to pay my $150 of my rent that I'm supposed to pay, because it was like, hey, you're already getting a subsidy. So we already saw that. So when those things ended, I think that's what I saw that was now, it was, hey, we've now moved back into going into the school buildings. For some schools, some kids were going to school. Some parents didn't have the ability to have their kids go back to school because they had another parent at home that was elderly, so they didn't want to have that exposure of the child out because of COVID. So it was a gradual thing. Offices weren't even all open, so therefore you could not go down and get the tools and the things that you needed because of the remote working that a lot of the world was still doing. So they couldn't really still put their hands on some of those resources that they need to get to continue now, to like get back on what they were trying to do. So payment stopped, the world is trying to move forward, and they have to try to figure this out, but now cost has gone up. So what I'm getting from my STAT benefits doesn't cover my food for my family. So I think we saw that, and we continue to see that now with our families, and feeling that pain of that change and that abrupt change of the supports.
Wow. Jennifer, do you want to share a little?
Yeah, so hi everyone, thanks so much for having me here. I'm really excited to be here. I think the main way we see the benefits cliff in our work is through the Affordable Care Act subsidies. And I'm actually really excited to talk about this because our benefits cliff is no more as of now. So this is like a really happy thing for me to talk about at the moment. So a little bit of quick history. When the Affordable Care Act was enacted federally in 2010, one provision of that was obviously to make healthcare more affordable, was to give folks who were buying their insurance through the marketplace up to 400% of the federal poverty level subsidies to make that healthcare more affordable and to make sure that folks could pay their premiums more easily. And that was great. That was really helpful. But it really left out folks who were just above 400% of the federal poverty level. And coverage was still too expensive for them, even if they were at a higher income than folks below that were. And that's really where our benefits cliff comes in. And I have numbers here specifically. So I believe this is in 2020 dollars, but if an individual made $49,960 a year, they were eligible for subsidies. And below that, folks were eligible for subsidies. But if that individual made $49,961 a year, just $1 more, they got nothing. And that's the cliff, is that they just fell off those subsidies right away. And it was really frustrating because it was not gradual. And the picture that comes into my mind is like the Looney Tunes with Wile E. Coyote, right? He's just running off the cliff and just falls, and that's what it is. And it's a really odd interpretation and implementation of that law, because if folks at $49,960 a year are having trouble paying subsidies, they got about $500 in subsidies, which is really helpful. So if that was really helpful to them, folks who made $1 more would probably also really appreciate that, and that feels really helpful to them as well. And so that was just a really confusing and really frustrating part of the Affordable Care Act, is that folks who are at 400% and above, there's 400.01% of the federal poverty level and above, healthcare was unaffordable for them, and they went uninsured even if they have a higher income, and they didn't need necessarily, if they weren't necessarily financially eligible for Medicaid. And a lot of those folks had big families. They had a lot of kids who were dependent on them for coverage, and they just kind of, had to be there uninsured and hope that they didn't get sick. But that's no longer, because of COVID now, right? So you're talking about how the system changes and the system can shift based on the need. That's what happened is with the American Rescue Plan Act, or ARPA, in 2021, those subsidies were expanded and extended. So now that eliminated the cliff, and folks who are above 400% of the federal poverty level also got subsidies. And so it was a gradual arch built from subsidies to higher income, and you still got subsidies. It might not be as much as if you were at a lower income, but you still got something until you made too much money or enough money where you didn't need the subsidies. So instead of like a really sharp up and down, it was just a nice little archway there. And for folks, any folks who were enrolled in marketplace insurance, the coverage was capped for premiums at 8.5% of an individual's income, which was a really big deal because folks who were paying 400%, or folks who were at 400% of federal poverty level or above, some folks were paying 20% of their income in premiums, and that's a huge amount, especially if you're paying, 20% or 50, up to 50% on housing, and inflation, everything's really expensive. That's all of your income. What are you supposed to do? How do you live with the rest of that, right? And people start to think at that point, do I really need health coverage? And yes, you do. You really do need it, and they know they need it. But sometimes that money really is better spent elsewhere. If they are a healthy individual or a healthy family, they don't necessarily feel that that money needs to be placed in that way. So that was really exciting that that cap was added to 8.5%. No one spent more than that of their income on premiums. And then it was actually proportional to income below that. So even if folks were eligible for subsidies pre-ARPA, their subsidies increased. So not only did new people get subsidies, their subsidies, people who already had subsidies, increased. And I was going to talk about impact of numbers and another question, but this helped about 346,000 Pennsylvanians who now are either have increased subsidies or have new subsidies because of the American Rescue Plan Act. And then with the IRA, the Inflation Reduction Act that was just passed in August, those subsidies were expanded again or extended again until 2025. So they were originally supposed to expire at the end of this year in December of 2022. But then the new legislation extended that to 2025. So we're not over the hump yet. We were hoping to make those permanent in the IRA, and that didn't happen. We only got a 3-year extension, but it's something that's really exciting to a new foot in the door, right? And we're pushing the door a little bit further. But that's really how we see that benefits cliff in our work. And now hopefully we won't see it again because these new subsidies have been enacted.
Yeah, so those are great examples, and it kind of helps you to really see what people were experiencing. And so,
can I dip in? I wanted to give my counter weird example, but I wanted you all to be able to talk about actually from lived experience from somebody who is experiencing an episode of homelessness or what you're seeing with the ACA. But I want to talk to you about employers for a second, because employers are another player in this game. And so I'm Karen, I'm from Leaf Fund, and we talk to people in government. We talk to people creating policy. We talk to our partners in nonprofits with indirect service. And we also talk to employers. And what we have seen is employers are now, because of the pandemic, very aware of the benefits cliff. They have seen it in a very different way than the worker has. They have seen that people are not taking the job, reducing hours, turning down a job altogether, turning down raises, promotions, and they are trying to connect the dots to figure out, so what is happening? I can't attract and retain talent like I used to be able to, and I need to. We've had this, the great quitting, I forget what the name is.
Great resignation.
The great resignation. We've had the great resignation. We've had up and down job market. And what employers are trying to do is piece together, how can I get into understanding what's happening? This is decision-making at work. This is workers deciding to create the experience for themselves that works best for their lives. And so when we think about this as a problem for the end user, the public benefits recipient, we should also keep in mind on the employer side, employers, this is bad for business. And so this is a solution, we'll get to the solution part of this, but everyone is feeling this, and it's not just the public benefits recipient, it's also business. And I'm not here to make a business case about benefits cliffs, but what I am saying is that everybody has a role to play. And this affects us all. So that's it.
It really does. It really does. So what I want to talk about now are some solutions on the policy side. And so Karen and Niebert, can you talk a little bit about the LEAP Fund calculator and how that works and the importance of coaching?
Yeah.
Start.
Okay, so we have had the sheer privilege of being able to partner with ECS and teams here, and Niebert's team in specific, we've been able to work with on our Benefits Cliff coaching program. So we work with coaching programs. We work with coaches. We train coaches to talk about benefits cliffs with their clients and be able to walk them through what their own situation is, use our benefits cliff calculator, understand when and if that person will hit a benefits cliff, where it'll happen for them, and when they can surpass it. This is all in service of decision making. So what works for one person works very differently for another person. And so our coaching program, my senior program lead is gonna kill me. I've definitely messed this up, but we work on making sure that it is professional development for coaches. We work to make sure that there are resources and guides to be able to navigate the conversation, because many coaches have expertise in their own areas, but not in public benefits writ large in all of the benefits programs. And then thirdly, real number estimates and predictions around benefits cliffs. So this is what we came to Niebert with for her team. And Niebert, do you want to talk a little bit about why?
So why is this important? So let me just first start to say with, again, our rapid rehousing program, what we've kind of looked at and realized is that within our program itself, the way it's structured, the way HUD and our local entity, OHS, has it structured, it's a cliff in itself. It's already built in. Our families are assessed. There's a calculator of sorts that's given to us, a formula that we have to use to plug in all the individual's information in terms of their income that's coming in for the year. And that there's an actual calculator already. So we have to put that in there, and then it determines, depending on how many dependents we have listed for you and what have you, what credits you get, and then it spits out a number for what your tenant portion of your rent will be. And everybody coming in, every household has to pay at least 30% of their income has to go towards their tenant rent. So we have the subsidy then to pay the difference to that landlord. The program is set up, I believe, overall with HUD, it's expected to, once folks come in, I think like you have within the year, you can maybe like at 6 months do a recertification, and then if they go at 12 months, another recert, and they can get up to 24 months. We generally start off with all of our families that they are eligible for up to 12 months of the subsidy. However, the way our area is designed is that all of our families are to be recertified every 90 days. So our folks are referred to us who have no income. It can't be discriminatory of like, we'll only get referred to us if they have the likelihood of being successful and being able to rent on their own, right? That piece is off the table. So we get all folks from who have zero income to who are making $1,100 a month that's coming in monthly in their household. So think about when you have the family that comes in with zero, and they have no other real income other than $316 a month of TANF dollars or cash assistance. That's plugged in, and most likely they're going to have a zero tenant portion of their rent. So ECS is paying the full $1,200 a month for a 2-bedroom unit here in Philadelphia. So it starts off that way. That person within 2 months begins to gain employment because we're working with them on that. We're trying to help them get to stability. So they get income, and now at that 3-month mark, we say, okay, bring your stubs in. We need to see what you've been getting paid for your past 2 pay stubs or what have you. And then we have to plug that in again. And now it says, all right, well, now you're paying $150 a month. They've gone from paying 0 to $150 in the 90 days, but they've only just started that job 30 days ago, right? But the fact that they've gotten 2 pay stubs, we now have to make that change. It's the guideline. So I'm giving that as an example. There's already a cliff kind of built in the work that we do. With that being said, our staff are already trained and geared to knowing this and knowing that We have one task, one main job of helping them increase that income so that they can get to a place of sustainability and hopefully take over the rent at this unit, or be empowered and be in the right place so that if they don't continue at this unit, they can rent somewhere else at the end of this subsidy. So we're trying to help them build that and address any of the other barriers. So we're already working at knowing that once you get that, though, we know we're going to have to tell you, you got to pay a little bit more. You're not going to like it, but this is actually really good because it shows progress. So we're already coming with that imprinted in our DNA, our staff, that this is what we have to do, and we have to come from that stance. So how we engage our participants, we're already doing that, but in terms of using the benefit cliff, we try to help our families. We assess during case reviews, during supervision meetings with the coach supervisor and the stabilization coach covering the case. And we kind of review cases and see where people are. And from there, we may make suggestions. I sat in on a meeting recently, and just hearing what the worker was telling me about the participants' hopes and desires and what they're doing now, then I was like, hey, that sounds like a good case for the benefit calculator. Have you tried that? Maybe we should sit down with them. So this participant can get a chance to see what's going to happen, what's possible that can happen in terms of those benefits if they went from a job paying $10 an hour to $16 an hour, right? So this calculator allows us to kind of see that, and we can rotate it. We can move it even beyond the 17, and we can look at it and say, we can see where the cliff is going to happen. Then we can also say, if you went just beyond that, what it would look like and what benefits might get affected. So we use that in our check-in. So once a month, at least once a month, when we meet with participants, and this happens sometimes more than once a month, our coaches are able to engage that way and chat with participants. Sometimes we have participants that are like, I like that you guys pay everything. I'll just keep my $316. And we're like, so when we step away and I go home, right now I'm not worried about where I'm going to be, which is the real transparency that we try to have with our families. We want for you. We want you to want for you. We want to make sure that you're set up so that when this stops, when this subsidy stops, that you're going to be okay. You and your 2 children will be okay. So what if you just got a part-time job, and right now you're barely making it with the TANF to pay those utilities? What if you got a part-time job? So we sit down with them and we say, why don't we plug some things in? Would you be willing to sit down and do this? And generally they are. So we started actually onboarded with the benefit with My Leap Fund in February of this year. And we weren't able to do it a lot with many of our families, but there was one particular family that I think about that the calculator was used with, where the young lady, the children's father was in and out of her life. She was caring for 2 young girls. She was unemployed, had no income when she came in. But she wanted to do more, and she wanted to be able to take over the rent there. It turns out that she actually needed more supportive services beyond what Rapid would do, because the idea of Rapid is you either take over that rent or you move on somewhere else where you're paying rent at hopefully fair market value, and you're independent of a subsidy, and you're not returning to an experience of homelessness. So she really wanted to do more, and we did find that she needed more supports in the end, but she was willing to work. The relationship with the children's father was off and on. Just the 2 of them couldn't get it together right. He did well for the children, but the 2 of them just together didn't work right. So she was like, you know what, I can't keep relying on him to find a job. And we were like, yes, we want you both to work on trying to get jobs, and you both can be empowered. So she did sit down with her coach, and he had done the calculator with her. And he showed, okay, you're at 0, and what benefits do you currently have right now? So the system showed us. We were able to plug in everything that she had, and it did show us, it was able to let us know what she might also be eligible for if there was something that she wasn't receiving. So that was helpful. Then also what he did was she was already applying for a position. Once she got that position, they sat down again, or just before they got the position, and we put down the numbers of what her pay would be and possible estimated monthly gross income. And so we put that in, and she got to see what would move around. So she was like, all right. So, and her big thing was, well, as long as the SNAP benefits, I'm telling you, the food, paying for food is a big thing. As long as my SNAP benefits aren't affected, that's fine. That's okay if my TANF dollars just went away because I'm making this. But as long as I can help, I have some assistance with the food. So it worked out. She also was looking at, what if I made a little bit more? And she did graduate and make a little bit more. By the time she left our program, she did exit, and she was making a little bit more. But she went from zero income to, I think, like $2,400 a month now that she was bringing in. And she exited the program. We did help her get into another program that's more supported because she does need someone really doing some extra with her. And she's not quite ready to live independently. But she's still paying her rent, she's still maintaining that job. But this was able for her to look at it, and she was like, all right, well, maybe, and she did make that next step. She did make more by the time she ended, but she was able to see, like, you weren't hitting the cliff, but it's possible. And then we talked with her about how she might be able to prepare or to save a little bit in the meantime. You're not at that junction yet where you're gonna hit that cliff. So how can we help you right now to save? How can we make sure that you have other supports in place, programs with the electric company, what have you, so that you're not paying enormous amount of money for utilities and so forth. We did have her connected to our food pantry here to just have other supports. It was always good to have something else in place. So, I mean, those were things that we kind of put in place, just trying to work with her, and then also putting a little bit of money. I think it was $5 a month that she was putting away in the bank account. Minimal, but it was a start. She had nothing in the beginning. So these were things that we were able to at least try to work with her on, because it's coming, so how do you prepare for it?
And if I can just break in here, the big thing here is that nobody knows if they're going to hit a benefits cliff until after it's already happened to them. So this calculator is not genius, it's that it's missing right now. Like, it's been missing from the conversation. So when we start to think about solutions, this is why Leap Fund went, okay, number one, transparency. Everybody deserves transparency about what their situation is with the benefits they have. I couldn't even keep up with Niebert's numbers when she started this story. There's so much that you need to hold in your head to figure this out. This should be clear to everyone receiving benefits, when and if they will phase out, how it will affect them, so that they can make their own decisions. The other thing that is important in this is data. We need to be, as a country, collecting this data. I have said this to 1 million people. If we can, through the Department of Labor, track how many people get new jobs every month, we can track how many people turn down jobs. And then from there, we can also ask them why. We can start to get to some of this. You can't change what you don't measure. And then the third piece, then we get to the policy. And I'm not trying to slow things down. I want policy change. That is my whole goal. Please put us out of business.
But first things first.
But if we want data-driven policy, we need to collect the data, and we need to be giving transparency to public benefits recipients.
Yeah, so the benefits calculator combined with coaching is a very powerful tool. Mitch, your office has an outstanding report called the Philadelphia Upward Mobility Action Plan. And can you share some of your policy solutions that were outlined in that report that are germane to this conversation?
Yeah, sure. I'm loving the theme. So, just to thread some of this together, I opened up talking about deservedness. Other folks talk about choice. We talked about sort of institutional and systemic barriers, like the inability to share or capture or get data that helps us do our work and create that transparency that you're talking about. And so I think all of those things are super important to get to a solution and provide the necessary choice for individuals. And so, and it's all in context, right? So I was reading an article the other day about young people who were unrelated and buying a home together, and they call themselves like co-parents at the home, and it was like trendy and middle class folks. But unrelated adults can't live together, right? and own a home or rent and receive subsidy and benefits. That's a no-no, right? So it's trendy in one concept and like the hot new thing. In other concept, it's like cheating the system, right? And the innovation that needs to happen to get by is not cheating, it's innovation.
Yep.
And instead of the system changing, like housing counseling services do it, like somebody comes through the door, the people behind that desk, they say, oh, I can give you this, that'll get you 15%, I give you that, that's 45, another 62 of whatever you need. And they're pulling all of these resources that come through that community service organization and trying to make sure, and they're validating and they're getting the right documentation so that when they get audited, the feds are fine with it. But that's exactly what they're doing. The same folks at home every month or every week or every situation by situation are doing those very same calculations. So why don't we lift that up? So the system has to change, but also we need to support the ability for folks to utilize that choice. And for us, that's really around universal basic income. The opportunity to get money in that's predictable, that you can expect, that you can understand the time horizon on it, you can understand the strings that come along with it, and it allows you at least that breather to say, okay, every month, here's the stuff that I know that's going to attack this or that. Here are the people in my network. If I get stuck or if I have questions, I can go to and figure those things out. But here's that other portion that I can make sense of based on my own unique needs. You're talking about time, right? King started talking about guaranteed wage in the late 60s, right? To put it in local context as it pertains to my office, we were engaged in a global convening about universal basic income at Cal Berkeley in 2017. At that convening, one of the cohort members was a young guy named Michael Stubbs, who 2 years later started the first universal basic income pilot in Stockton. By 2019, the Philadelphia mayor had joined, the mayor's convening on universal basic income, co-chaired by Michael Tubbs, right? And so from the late 60s now to 2022, it took us that long to make
these expansions. And so I had said earlier that these extended subsidies were supposed to expire at the end of this year in December 2022. If that had happened, about 79,000 Pennsylvanians would lose coverage in 2023 because they would not be able to afford it anymore. So this is a very impactful policy that 79,000 Pennsylvanians now have coverage for the next plan year or have the ability to enroll in coverage in the next plan year at a more affordable rate than they would before. Another impact is that even if folks were still with below 400% of federal poverty, maybe they wouldn't lose coverage, but they'd have to drop to a lower quality plan because they wouldn't be able to afford the higher quality at the newly higher price. So this is a really either way, it's not good if these subsidies go away. But I think another angle in this is the COVID-19 angle. So the public health emergency has been in place since March or April of 2020, and part of that is the moratorium on Medicaid enrollees and Medicaid determinations and Medicaid churn. So what that means is that folks who were enrolled in Medicaid in 2020 when, jobs kind of exploded and people needed coverage because having health coverage is always important, but was really important during a public health emergency and during a pandemic. They enrolled in Medicaid, and now until the public health emergency ends, they are not allowed to be unenrolled from Medicaid. So Medicaid typically has about a year of redetermination. So every year they look at somebody's income and they say, do you still financially qualify for Medicaid? A lot of times the answer is no, but they cannot do that until the public health emergency ends. We don't know when that's going to be right now. It could be in a couple months. It could be next year. We have no idea when it's going to end. We can guess, but no one really knows when this is going to happen. And so until that point, people who are no longer financially qualified for Medicaid are still enrolled in Medicaid and are still able to reap the benefits of that program and get health coverage that they might not have otherwise. Eventually, the public health emergency will end. It will happen at some point. We don't know when. But when that happens, people are going to be redetermined for Medicaid, and a lot of people are not going to qualify anymore because their financial situation has changed. That's fine, but if those subsidies then don't exist anymore, there's going to be a lot of people that are uninsured because they don't qualify for Medicaid, they make too much money for Medicaid, but then they make too much money then for subsidies, and then they're just uninsured. And that's going to be a real mess in that moment there trying to redetermine everybody for Medicaid, even if folks who do financially qualify are still going to have to be redetermined because that's how the program works. For better or worse, that's how it works. And between DHS trying to redetermine everyone for Medicaid and then folks who are rolling off of Medicaid, trying to figure out if they are eligible for subsidies, if they're eligible for a penny plan, what that looks like for them, it is going to be a real mess. And so it's really important that we keep these policies in place and we keep these expanded subsidies in place to keep that benefits cliff from coming back and to keep folks enrolled and with as little gap in coverage as possible.
Okay, so we're going to take some questions from the audience, but before we do, I want to have one last lightning round. So I want each one of you to tell us one thing that we can do that will help advocate for this issue. So why don't we start with you and work our way down?
Sure.
Jennifer.
So I think the most important thing that you can do to have this issue is to talk about it. I think in my experience, I spend a lot of my time talking with policymakers at the state and federal level, and for better or worse, they don't know how these policies that they are passing and debating are being implemented, and they do not know what that looks like on the ground. And so I think talking about the impact of the policies that are really great, talking about the impact of these subsidies and how this benefits cliff or lack thereof has been really great is really important, especially because we're going to need to, again, keep pushing for these expanded subsidies in 2025. We had asked for them to be made permanent in the IRA and the Inflation Reduction Act. We didn't get that. So we only got it for 3 years, which is better than nothing, but it's still not great. So we really need to keep pushing and keep advocating. Even now, we can take the win where we have it, but keep pushing and keep advocating even now to make sure that our lawmakers, especially as we get, a whole new bunch of folks in the General Assembly, a new governor that's coming in November and in January, a lot of new senators and House members that are coming in January. We need to keep talking about the impact of these and make sure that they really understand what that looks like on the ground and how can these policies really impact folks.
So advocacy starts at the community level, I believe, and so this is a form of advocacy through education, right? We need to create learning groups and opportunities to learn from each other and understand what's in our ecosystem and where to push and also where to build centers of power in communities, community-driven power centers. I'm still on that. And then some of those examples, and so like the city is supporting or either driving 5 universal basic income projects. One of them was working with PHA folks who were on the wait list for housing, understanding that there was a benefit cliff, subsidizing them to meet offset the increased cost because of that benefit cliff, and then pairing them with skilled folks from our Benefit program to help, similar to your program, educate and walk them through. The TAP program in our water department is an example of that tiered sort of intervention based on income, and it's still being able to provide a benefit without shutting folks off. And CTC is the closest thing to what you were talking about, the permanent expansion of child tax credit, which really reduce child poverty. And I think food insecurity dramatically. And so if you happen to run across Pat Toomey or Bob Casey, advocate for the expanded child tax credit. We need both, the inside and the outside game.
So I'm going to take a different stance a little bit. Agree with what everyone has said. I guess my appeal and my ask is, given what you're hearing about benefit cliffs and what families and individuals are experiencing, and as you're learning about this, keep that in mind, continue to try to learn more about it. And I'd like to do an appeal to landlords. I'd like to put that out there as we partner with landlords now in our program. But if you're out there and you're a landlord and you're interested in having your unit occupied and someone living in there, and that you'd like to, I guess I welcome you to join in ECS's mission to challenge poverty, and join us with that in such that you can help offer a space to an individual participant, a family, who is trying to address barriers to housing insecurity and who's trying to get themselves situated so they can continue to be productive in our city, in our communities. So keeping in mind all of this benefit cliff, my appeal is also to not to just keep up with the other landlords and whomever else is, trying to hype those rents up and making it very much hard to live in Philadelphia and to rent. But if you're able to, and I get it that a lot goes into, why rents are what they are. If you're able to, if you've got a good tenant, you've got someone in there, and you see that you can make a difference, and we welcome you to join in our mission. Keep rents reasonable. Keep in mind what families are struggling with, just to try to keep up. Keep in mind what others who are making good money are also dealing with, and think about that. And I'm just asking that people try to hold on to rents at a reasonable rate so that families have a chance to continue to be productive, to continue to help our city to grow, and families to be able to thrive here. So that's kind of my appeal, what you can do.
And I love that. And there are half steps, right? And so for homeowners, right, your mortgage is due when?
First of the month.
Right? But you have a grace period up until when? 15th, right? If you're a renter, your rent is due between the 1st and the 5th generally,
Yes.
and then the fees start to kick in. So what if you just, as a half step, say, hey, deservedness, trustworthiness, right, dignity. What if you extended the grace period, right, and allowed some flexibility? Right? There are little innovations that we can make. I just wanted to make it tangible, that we can make to treat people honorably and maintain that good long-term tenant, right? You don't want to turn that unit over.
Yes.
Thank you for that. Yeah.
Well, I am very blown away by all of your different perspectives. I really appreciate learning from you. I will say for us, we have 2 websites about benefits cliffs, Mitch, not just the one.
Okay. Let me get it down.
So the first one is, myleadfund.com. If you are an employer or a nonprofit with a coaching program, please get in touch. We are doing a lot on the education front, which leads right into this advocacy piece. And we've got many programs on both the policy side, the employer side, and the direct service side. The other website we have is benefitscliff.com. We put this together because when we started in 2018, we couldn't find it. We couldn't find this. And so we did all the research. We did a ton of research, and we never wanted anyone else to have to go do that research again. So this website exists not only to explain what benefits cliffs are, but also it has a whole section on policy. So if you're curious about what federal, state, and local policy proposed and passed looks like, we've got a whole collection of stuff that's up there. If you want to learn about how guaranteed basic income intersects with benefits cliff, we've got stuff up there. We've got studies, we've got metrics. This stuff is there's really smart people that have been working on this for a long time. It's just been buried in academia, in economics, in the legislatures, and what we've tried to do is pull it all together to make it more accessible. So we don't make any money off of it. It's just there for you. So if that helps in advocacy, and the last thing I want to say is building on what Mitch said around community, communities have power. And even if it's not the one that you're thinking, like, oh, I've got to go talk to the policymakers, maybe you're a member of your local chamber of commerce. If you and your other members start talking about how benefits cliffs are affecting you as employers and start to make a plan of advocacy to the legislature, they listen because you are the commerce. You are the commerce. So there are multiple ways that you can sort of look at this, multiple lenses. In the communities that you are in, there are always levers of power. So use them.
I love that, kind of coming at it from both angles. So we want to take questions from the audience. Does anyone in the audience have a question?
we have anybody from online?
For any online questions?
All right, let me end the painful pause here. Talk a little bit about, from your perspective, the other side of solving the problem is workforce development and job creation at a living wage. Where do you see that intersection in your work, or is it complementary to the work? I mean, we've, again, just from an ECS point of view, it's interesting. Our first call to action was the benefits cliff.
Serious talking to you.
Are you kidding me? But if you could just, again, the intersection and how to, have a 1-2 punch. While people are working towards living wage, working towards job creation, is there a patience level? I heard all of you speak about, look, let's be patient while people are moving along. Just be curious, given your experience, where you see that intersection.
I can kick off if you want. So, I think it's extremely important. I mean, some of what guides our work in sort of layman's term in regards to economics is sort of this idea of earn, keep, grow, right? Like it starts with income, your ability to sort of save and build on assets, and then like sort of working towards wealth building. We want folks, most particularly low-income folks and folks of color in Philadelphia, to be on a trajectory towards wealth building. And certainly workforce plays a crucial role in that. We're working in a couple of pilots that I think are important to share. One is really engaging with folks who are either currently incarcerated or formerly incarcerated, and creating interventions upon release. And so most of these individuals participate in some sort of programming in anticipation of release. And so it's financial counseling and home ownership and, mental and behavioral health supports. And so once they hit bricks, once they get released, that's West Philly coming out. Once they're released, then they already have these relationships and supports already in place. We thought that was good, but how could we sort of add some steroids to that? And so what we did was we added a $1,000 unrestricted cash advance that they could use for whatever, and some level of housing subsidy that could last up to 6 months, and ability to recertify after that 6 months. So they're getting already what they're getting. They're getting unrestricted dollars that they can use for housing or anything else, and then a place to rest their head. People, places, and things. And so if we understand the issue around recidivism, it's really about the people and the environment, and sometimes forced to go back there, right? And so if we, again, and I can't stress enough the issue of stress, the toxic stress, right? If you could just have a place to stay, that you're going to be in there, you can participate in a job program. We support 2 programs in specific, First Step Staffing, which is a staffing agency here in Atlanta and other cities that do really tremendous work, and CEO Works, traditionally out of New York, that work with formerly incarcerated folks. And so we do those things just to get them up and going, but our main population is the most vulnerable population. So we work the first step before even first step staffing, right? The more transient vulnerable population. And then we also work with a tremendous set of partners on same-day work and pay, bringing a community of learning with multiple same-day work and pay partners, where folks are engaged in work on a daily basis, again, using their choice and their need, how to connect what kind of work they want to do, and what part of the city, and what provider. And so that's CLIP from the city side, and mural arts, and ODAT in the community, and things of that nature. So
I would also add on, it's interesting, this workforce development piece combined with the benefits cliff. So when you start to think about, thank you, when you start to think about people that are training for a new job, you want to make sure that they are making a job that is going to sustain them and be a living wage. There are many jobs, though, there are many programs that don't actually pay a wage that someone can self-sustain themselves and their family. And so we have talked with folks that are running workforce development training programs that they're like, we actually don't want to use your calculator. Because what's going to happen is people are going to turn down those jobs. They're going to realize that they are better off not taking the job. And our metrics from our agency, our government agency that we're working with, is on placements. So we get paid for placements. We don't get paid for the training. So when you're thinking about, systemic sort of high level thinking, we can also think about workforce development training as a place for some innovation.
Yep.
Are there any other questions from the audience or from, yes? Yeah, 2 questions.
Karen, you may need to rephrase because of the Wi-Fi listeners, but they're the online listeners rather. But your point earlier about research, you talked about it literally just now about the workforce development engagement in that ecosystem, about the Department of Labor stats around jobs that are taken and those that are not, which we're not looking at. And I'm thinking about all the wonderful schools here in Philadelphia. Is there a research project, a research question that you have in mind in terms of what folks are walking away from and what research needs to still be done in partnership with communities so it doesn't sit on some professor's shelf unused, but activated, because that's where real change happens, is through civic engagement, it's not through unnecessarily activating it. So.
Could you share your name?
Oh, hi, I'm Sanaye Muhammad.
There you go. People want to know who gave that brilliant question, so I'll give you credit.
I'm not going to have a brilliant answer for that. We are a very small team at Leaf Fund. We are running programs for employers, for nonprofits, and for policy. So we don't have a research project in mind. But what I will say is what's very interesting to me is how many you'd be surprised at the entities that contact us to ask us for our numbers. And I'm like, we're Little Leap Fund. You're the government. You have the apparatus, you have the system to collect the data. You have the resources. So while I don't want to kick it back on someone else and say, you do the research, I do believe we already have, the reason I use that Department of Labor example is that we're clearly already collecting the flip side of the question. And so it's not like we need to create a whole new department for this. We don't need to create more funding for this. It is just one more data point for what we're already searching for. So yes, I agree with you, and I agree that it should be including communities that are most affected.
I have a quick add, and I won't take up too much air. I do think, and folks, I'm cynical, right? And I think healthily so, but I do think timing matters. And coming off of COVID and the social unrest, I think folks are really more solution-oriented and open to not sort of stand guard at the institution, right? To follow the rules even though the rules don't make sense. Folks now have an experience of saying, hey, this was a barrier, we understood the need, we had to make something happen, and we did it. And I think there's just more appetite of being more solution-oriented in systems and institutions. And so I think if you found that you weren't successful prior, the 2.5 years ago, go back. There are real change makers and folks who really want to problem solve and be more successful.
Yes.
So I'm Caroline Dunleavy, and I have maybe not so much a question, but something that I would like you all to address in the last few minutes of the questions. We talk a lot about income, working, getting a raise and all that, but there is another aspect of the benefits cliff that we do try to lift up here at ECS, and that's asset limits. And I was wondering if you could speak a little bit more about that from your perspective, because there is that piece of benefits cliff where somebody touched on it earlier. If people can't save, they can't get a car, they can't do a lot of things. And it's something that people also need to understand about the dynamic with some of the public benefit programs and the savings and asset accumulation, because it leads to wealth accumulation, let's be honest. And then that's another whole generational and transfer, wealth transfer and all of that. So that's why it's important to look it up.
I can dive in real quick and say, yes, asset limitations, they gotta go. They gotta go. There has been proposed legislation to remove them, at least in New York City. Yes, it's a huge problem. I'm sure everyone on this panel and the folks that are in the audience have seen the studies. 40% of Americans don't have $400 saved. Yeah. And we have asset limitations for the benefits that we enforce. So that, for me, it's like, we gotta get rid of them.
Yeah, I can speak on that a little too. Agreed. I'm not going to repeat what you said. I think that's great. And I think this actually speaks to your question a little bit too, is that, and I'm trying to remember to keep my Pennsylvania Health Access Network hat on at the moment, not just Jennifer Wolf speaking, but like healthcare is a human right. Yeah, and like it should not be tied to, quality healthcare should not be tied to how much money you have or what assets you have or what job you have or if you have a job. And thinking about healthcare generally is too expensive. Even if people have a lot of money, it's still really expensive, and people are spending a lot of money on good quality healthcare, or they're spending a lot of money on poor quality healthcare, and they're spending a lot of money to get not a whole lot of services in that. And so I think that separate from, whether we're working with folks in job development or in assets, healthcare needs to be made more affordable and higher quality. And I think there's things to think about, whether it's removing asset limits from health benefits or other benefits that really tie to health, and making sure people have food, which is a big part of health, making sure people have money to get to their doctor's appointments. But it's also thinking a little bit about untying and detaching healthcare from employment, and making sure that healthcare is, a lot of people have employer-sponsored coverage, and detaching that and making sure that folks don't need a job to be able to have good health care, and they don't need a job or a good job in order to have good quality health care, whatever good means, right? Whatever that looks like. But people, especially in a public health pandemic where people did not have a lot of jobs and really needed good health care, what did that look like, right? Well, people were able to get on Medicaid, and people were able to get, we had these subsidies expansions, and so people were able to get good health care without having a job that required the job sponsorship of that. And so I think thinking about that is because people can't work well if you're not feeling well, right? No one wants to go to work with the flu. No one wants to go to work with a fever or COVID or anything, right? And so being able to not have to if you lose your job because you are too sick and because you're not feeling well, you shouldn't lose your health care as well. So I think thinking about that is a big part of keeping people safe and healthy too.
We have one question from the audience.
You online, that's the campaign kind of question. Is the fund working with any other nonprofits in Philadelphia, or that's part of your pilot?
Not yet, but feel free to get in touch. info@mylatefund.com. We are working across the country. We work nationwide. We work with folks in a variety of states, but yeah, we could certainly use a few more Pennsylvanians in our sphere.
Okay, so I want to thank all of you for these great insights and even more innovative solutions. Like I said earlier, I think we can work on this just with the folks that are up here. We've got great ideas, transparency, innovation, patience, knowing where your benefits cliff is going to occur. All of these things are not that difficult to do. And so I want to thank you all for participating. I wanted to also share that Episcopal Community Services is asking you to contact your federal legislators. And you want to talk to them about the things we talked about today. But specifically, we want them to reinstate the expanded child care credit. So you want to reach out, make calls, send emails, send letters. And ECS makes it easy for you to do. You can go online, and you want to click the Action Center on their website. And that will give you a form that you can fill in, and it will go to your federal legislators. So I want to, again, thank you all, and I want to call up David Griffith to end us with some comments and some words.
First of all, let me, Iola, say thank you. I'm going to stand back here so the
Yes,
guys on the
thank you,
camera don't
Steve.
go crazy. Don't get nervous, Mitch.
West Philly.
Yeah, I
Hey, that's really the best.
know. You and me. Now I know that when I got out, I hit the bricks, so that's okay. Iola, first of all, thank you for hosting, and just delightful to see you again. And let me thank Jennifer. Appreciate you. I know you had to really scramble to get here, so thank you. Mitch, obviously, always good to have your opinion. Niebert, terrific. And Karen, there are no other agencies you want to work with in Philadelphia. So let me just say what I'm really, really proud of is our advocacy group. When we created it, I asked Victoria and the team to focus on what I call SPPs, which is stupid public policy, and drive change. And the advocacy group has gone from, Victoria on her own to now a team that's rocking and rolling, engaging with a lot of folks. And I want to give you one example of where that advocacy group has actually gotten traction, and like you, the 3 years is better than nothing. But we work with State Senator Art Haywood and his staff on the benefits cliff, and we were hoping for legislation change. We couldn't get that done, but we were able to get, and the senator was very, very clever and creative here with his partners in the Senate, to change the budget. And so additional funding has been allocated to allow a new threshold exit. So rather than being 200%, it's 300, and that's smoothed the impact. It's not as steep a benefits cliff. It's still a cliff, but it's still good action. And I can absolutely tell you, though, that some of those ideas came out of the work that the team is doing here and some of our partners. So there's an example of where advocacy kicks in. I'm not going to repeat what Iola said on the expanded child tax credit. You've got the information. I'm going to ask you to really, that one has a huge impact on many of the people we serve. And so we're going to ask you to advocate on behalf of those individuals and move there. We believe at ECS that impact is one of our core values, and delivering impact, whether it's on a program basis, whether it's on a partnership basis, which we have some examples here today, or on transformational work that we do with our Mindset program. We believe that the way out of poverty at the end of the day is a living wage job with benefits and assets in the bank. And the Cliff benefit works both ways in that scenario. You will hear from us. We hope to have these forums, what we call our efforts at thought leadership, and you guys have really set a high bar for that on an ongoing basis. Nathan wouldn't let me say quarterly. I have to say ongoing. But we'll negotiate that and work that forward. So let me close with just a very simple thought. As you know, Martin Luther King has lots of things that he said that have relevance to all of us in our day-to-day life. But the thought I think about all the time is the most, that he said in one way or the other, that the most tragic thing is that good people remain silent. We cannot, as a body that does this work, remain silent on the issues that impact those individuals who face poverty day in and day out. And so when we call on you to attend forums, to write to your senators, to take personal action, to support people who do this work, it's your way of breaking the silence. And therefore, we thank you for helping us do that today. We hope there was interest in the issues. And again, go to our websites. We only have one, so it's a lot easier. But please join us in the movement and let us no longer be silent and take actions. So with that, let me wrap it up and say thank you. Take care.